Good morning. Today I'll be presenting our study findings on abdominal low-intensity pulsed ultrasound moderates pro-inflammatory phenotype and improves therapeutic outcomes of Murine 41 breast tumors. Vagal immunomodulatory effects, also known as the cholinergic anti-inflammatory pathway, can alter the immune system's activity via innervation of various organs such as the spleen, liver, and the gut. The proposed mechanism postulates that the parasympathetic vagus nerve transmits signal through the sympathetic noradrenergic splenic nerve, where norepinephrine released by the splenic nerve binds to beta-2 adrenergic receptors of splenic CD4 positive T cells, triggering release of acetylcholine, which upon binding to the alpha-7 N-nicotinic acetylcholine receptor positive tissue macrophages inhibits the release of pro-inflammatory cytokines such as TNF alpha, IL-1 beta, and IL-6. Experimental studies in animal cancer models have demonstrated the beneficial effect of vagus nerve activity in tumor development. Moreover, vagotomy studies have confirmed the protective effect of an intact vagus nerve on cancer progression. However, evidence for an interaction of the vagus nerve and the immune cells relevant to tumor microenvironment is scarce and not fully understood. Moving on to experimental methods, in order to take advantage of vagus nerve innervation in multiple abdominal visceral organs, we investigated whether application of lipase to abdomen could non-invasively modulate the cytokine, chemokine, and immune cell profile in a 41 breast cancer flank tumor model. So 1,041 cells were injected subcutaneously and bilaterally into the flanks of female BALB/c mice, and once tumors reached 5 mm in size, lipase was applied on the splenic side of the abdomen using a 5 cm square 1 MHz transducer at an intensity of 2 watts per centimeter square and a duty cycle of 10%. Lipase treatments were done as 2 sets of 5 days each with a 2-day break between the treatment sets, that is from day 1 through day 5, and the second set on day 8 through day 12. Tumors, spleen, inguinal lymph node, and brains were harvested at specific time points for various analysis. So to look at the acute temporal changes within 41 tumors following lipase treatment, proteomic analysis was performed on days 1, 3, and 5, the tumors. So here, day 1 tumors exhibited a pro-inflammatory profile with significantly increased levels of IL-3, 5, 9, 12p40, 12p70, IL-15, and IL-17, along with the GM-CSF and MCSF. Day 1 spleen samples also displayed an increased levels of pro-inflammatory cytokines, and excluding significantly lower levels of IL-12, P40, and VEGF, no significant differences were detected in 41 tumors or spleens following 3 days of lipase treatment. And day 5, 41 tumors showed increased expression of IL-4, IL-6, LIX, MIP2, and VEGF, and decreased levels of IP10 and MIG with a relatively inactive profile for spleens. Moving on to flow cytometry data. So flow analysis of day 5 spleens showed significant decrease in regulatory and cytotoxic T cells, total macrophages, and specifically the M2 phenotype and MDSCs. And day 5 tumors showed significant reduction in helper T cells, and this could very well be indicative of the lipase-induced activation of the cholinergic anti-inflammatory pathway. As a validation of lipase-mediated activation of vagus nerve efferent fibers, enhanced double positive immunoreactivity of CHAT and C-FOS was observed within the dorsal motor nucleus of vagus nerve area in the mice brainstem following 5 days of lipase treatment compared to time-matched controls. We can also clearly see that the lipase-mediated antitumor effect was blunted in splenectomized mice, because lipase to abdomen significantly slowed tumor growth starting at day 8 in wild-type mice, but not in splenectomized mice, also implying the role of spleen in the observed antitumor effect. Proteomic analysis of day 12 lipase-treated 41 tumors revealed a CCTF profile exhibiting an overall attenuation of pro-inflammatory response in wild-type mice compared to splenectomized mice, indicative of a shift towards an anti-inflammatory TME. We saw significantly decreased expression of IL-1 beta, 2, 3, IL-12, P40, GM-CSF, KC, LIX, and others, along with increased expression of IL-9, interferon gamma, E-toxin, MIG, and TGF-beta in wild-type mice, and high IL-3, IP-10, MCSF, LIX, TNF-alpha, and TGF-beta levels in splenectomized mice. Flow cytometry data showed of a day 12 41 tumor, spleen, and regional lymph nodes harvested from lipus-treated wild-type or splenectomized mice revealed significant reduction within the tumors or spleens of wild-type mice compared to time-matched controls. And checkpoint inhibitory receptors, CTLA4 and PD1, were also decreased within 41 tumors following lipus, while the percentage of PD-L1 positive cells within these tumors was increased compared to time-matched controls. Essentially, no change between immune cell population or checkpoint inhibitors within tumors or lymph node of lipus-treated splenectomized mice compared to time-matched controls, except for M1 macrophages, was increased in the lymph nodes on day 12. The observed decrease in immune cell count within the tumors and spleens of lipus-treated wild-type mice compared to the splenectomized animals may indicate a customary pattern of the cholinergic anti-inflammatory pathway. To further examine the associated anti-inflammatory effect following lipus stimulation, 41 tumors of lipus-treated wild-type or splenectomized mice were co-stained for alpha-7 nicotinic AChR and F480, and results showed enhanced double positivity for both the alpha-7 nicotinic acetylcholine receptor and the F480 within tumor sections from lipus-treated wild-type mice compared to time-matched controls. In contrast, no statistical difference was detected in 41 tumors derived from splenectomized animal groups. These findings imply that the spleen had a crucial role in the anti-inflammatory effect associated with lipus, and it also correlates the alpha-7 nicotinic AChR expressing macrophages to the observed effect. To further determine whether lipus stimulation could alter the distribution of the macrophage phenotypes within the TME, we examined the M2 marker CD206 and M1 marker INOS localization in 41 tumor sections of lipus-treated wild-type or splenectomized mice. Interestingly, tumors from lipus-treated wild-type mice exhibited significantly more INOS expressing M1 cells than the time-matched control group. In contrast, no difference was observed in the INOS-positive cells between tumor sections of the splenectomized mice with respect to its time-matched controls. Also, no major differences in the CD206 positive cells detected within tumors of lipus-treated wild-type and splenectomized mice compared to their time-matched control group. Existing literature points towards the initiation of the cholinergic anti-inflammatory pathway through a process which starts with a sensory vagal afference. In response to noxious stimuli or tissue injury, unmyelinated sensory C fibers release pro-inflammatory tachykinins such as substance P, which can induce vasodilation, increased endothelial permeability, and inflammatory cell influx. So this, in addition to the ligation of the neurokinin 1 receptor or the NK1R on inflammatory cells, can lead to further release of substance P and pro-inflammatory cytokines. Vagal efferents will pick up this signal and activate the vagal efferents, initiating the cholinergic anti-inflammatory pathway, leading to decreased production of pro-inflammatory cytokines. So, pursuing this cue, we checked substance P levels in tumors and guts of lipus-treated mice and found increased levels of this pro-inflammatory tachykinin. So this picture outlines the proposed mechanism of lipus-mediated substance P-driven neural modulation of inflammation. So this starts with lipus is considered to stimulate the sensory C fibers, leading to substance P release, followed by the release of pro-inflammatory mediators and more substance P through the substance P NK1R receptor-ligand interaction. So then the vagal afferent would pick this signal, effectively firing the vagal efferents and initiating the CAP cascade, leading to inhibiting the release of pro-inflammatory cytokines such as TNF alpha, IL-1 beta, and IL-6. Conclusions. Chat and CFOS positive, double positive immunoreactivity in the DMX brainstem in lipase-treated wild-type mice brains validates the activation of the inflammatory reflex via vagus nerve stimulation, and also alpha-7 NACHR and F4AT double positive regions in the tumor sections correlates the specific macrophages to the observed effect. In comparison to the splenectomized mice, an overall attenuation of pro-inflammatory markers, immune cell populations, as well as significant decrease in tumor growth rate were observed in the wild-type tumor-bearing mice following 10 days over 2 weeks of abdominal lipostimulation. The observed decrease in immune cell count within tumors and spleens of lipase to the abdomen in wild-type mice may indicate a customary pattern of the cholinergic anti-inflammatory pathway. Lipase-mediated substance P-driven neuromodulation of inflammation is proposed as a possible mechanism of the observed antitumor effect. This will be further confirmed with more in-depth studies. Collectively, these results provide insight into the neuroimmune communication of the cholinergic anti-inflammatory pathway and highlight the potential use of lipase in combination with conventional cancer treatment to modulate vagus nerve-mediated inflammatory responses relevant to the anti-cancer immunity. Thank you.